get involved in a whole different milieu of treaters, and you can do wonderful things, and you can integrate your treatment with medical staff, with psychiatrists, with Army staff. And that was enriching for me. It really was. And I just felt coming back that, I think I want more autonomy. So I bit off what I thought was more than I could chew, but it worked out, and got my medical degree. And then my training began at University of Kansas, the internship year. And the training there was supposed to be eclectic. At least that's what they presented it as. But I found out it was really biological, almost totally biological. Some of the professors from Menninger's came over and taught psychotherapy, dynamic therapy, and I said, as a psychologist, hey, this is kind of where I ought to be. And so I applied for entrance into that program, and they accepted me, and then from there to UCLA and a rotation in advanced clinical pharmacology and assistant professor, and then the war breaks out in overseas with the Gulf War, the Desert Storm, and I said, I'm going to volunteer as a civilian, go overseas. So that's what I did. And that was a tremendous and enlightening experience. Because there, I was working with really active duty military and officers and high-ranking officers as well, and encountered my real challenge with a 4-star general in the Department of Defense. That's in my book. I won't go into that, but that was a real learning experience, a grow-up experience. I guess at my age, I had the will and fortitude to stand by my ethics and the Hippocratic Oath. And I'm not sorry I did it. I'd do the same thing again. So
that's incredible.
So the training at Menninger's was really it was just magnificent. My mentor, Walter Menninger, the son of Bill Menninger, William Menninger. Well, who was William Menninger? William Menninger was a brigadier general, and he established psychiatry as an accepted practice in the military during World War II. And so Menninger's really has a lot of roots of the history of military psychiatry. And I cut my teeth on Vietnam vets, World War II vets, did a lot of group therapy, and learned a lot from it too as well. And not to mention hypnotherapy. Well, because I think hypnosis really has a place. It has a place in this stress syndrome. It's just through the bad press and public things that have happened, they have not given it much attention or priority. But I think that's a mistake.
It's interesting that you say that, because I understand that hypnotherapy is so effective for a multitude of things, and I'd never heard for PTSD. So this is incredible.
Well, let me give you an example. Dr. Watkins, rather famous psychologist, worked with World War II vets, and I went to his workshop. And this is after I first learned about hypnosis, actually in Singapore. I went after the Vietnam War. I went down to Singapore for 2 years and worked also as a psychologist. And during that time, there was someone by the name of Dr. Hartland. Dr. Hartland came to Singapore and offered a workshop on hypnosis, but really offered this to medical doctors who would use hypnosis as an anesthetic for surgery. So I allowed him to hypnotize me, not knowing that he was in England known as the father of hypnosis of England. But I got really excited in this. And so anyway, back to Dr. Watkins. Dr. Watkins, working with World War II vets, talks about his case of a young combat soldier, World War II, in Germany, and faced with a machine gun nest of Nazi soldiers that were shooting at their company. And he was probably 100 yards away, less than 100 yards away. Yeah, probably 50 yards away. Because the colonel, he ordered him to throw the hand grenade. He has the hand grenade in his hand. He has his index finger on the pin, and he freezes. He freezes. And there were many casualties because of that. So coming back out of the war, this soldier was crippled. He could never write his name. He could never use his index finger, ever. Well, he gets to see the psychologist. He referred to Dr. Watkins, and Dr. Watkins put him into a trance, and he brings him back to the scene. And through repetition of interpretation, he reinterprets the scene that the colonel really didn't tell you to throw that hand grenade. And does this often enough to where the subconscious and the unconscious, they come and fuse together in a force of mandate, and he's able to accept that he did not disavow, he did not disobey that order, and the paralysis was gone. So that's just an example of the power of hypnosis and what it can do for some of these cases of PTSD.
That is amazing. That is absolutely amazing that his hand began to work again. And then, you know what I thought you were going to say? I thought you were going to say that he was reprogrammed with, he threw the grenade. So it's interesting that he was reprogrammed with, he never got the order.
Actually, the reinterpretation.
Wow.
The constant reinterpretation over and over by the hypnotherapist, which was Dr. Watkins at that time.
That's so interesting.
Yeah, my first case that I got was as an intern at the University of Kansas Medical Center, and they thought this patient needed a CAT scan, had a tumor, a brain tumor, had a horrible headache, and he showed up in Kansas City, had driven for 3 days from California and was in fugue. And it turns out he was a multiple personality. And I worked with him several hours, age regressing him back to different stages of his life. And what you find is that multiple personality, if they're really a true, we call it now, the name is dissociative. But anyone that really has this syndrome has the most horrific trauma in their life. Childhood trauma beyond anything that anyone could imagine. It truly is. Truly is. Yeah. So that case I took all the way to Vienna to the World Congress in 1984 and made my presentation at the World Congress.
That's incredible. Absolutely incredible. And all of this before you went on active duty.
Yes. In fact, I was seeing veterans. I was working with active duty in field hospitals in foreign countries, listening to the woes and the torment and the tragic trauma which war had brought on, both invisible as well as visible scars. And having never joined that supreme fraternity called the Battle Buddies bothered me. It really bothered me. And that discomfort chased me through most of my career until age 63. I said, I'll join. Well, by the time the Pentagon got around to making a pass on my age, I developed a heart condition. And at that point, I needed a pacemaker. I had a base rate of 43 beats a minute, and I skipping beats about 3.5 seconds between beats.
Oh my
I would lay
gosh.
in bed at night and couldn't hardly get to sleep because every beat, it felt like it was coming out of my chest to try and make up for the skip beats. So when I sent my documents in, they said, we want you to get down to Fort Sam. Well, the average lifespan without a pacemaker in that condition is only 5 years. I'll tell you what,
Oh.
I said, I'll do this or die. If I have to die trying. And that's how I went down to Fort Sam Houston.
Oh my gosh. So, okay, I want to back up a little bit. So, what was the obstacle of like getting into the military at 63? Because that's
Well,
way past
the
the age.
obstacle was I was paired with my grandkids. It was like grandchildren. I was on the platoon the first day I was there, and they divided everybody up. Everybody chose someone, and just by default, I didn't have anybody except another person, a female, that was there. She's half my age, and this is all in my book. In fact, she's on the front cover of my book.
I noticed there was a female there,
my
and I was going to
battle
ask
buddy.
about it. Is
Yeah.
that what your panel buddy? So you got
That's my
paired
battle
with a girl half your age
That's
when
right.
you get there. And I just, because there's so much to that. Like, first of all, there's the deciding to go in at that age, and then having to get special permission, like a waiver from the Pentagon. And then you have the heart issue, and then you get down there to do it. And then everyone's so much younger than you.
I was like I was on another planet. I mean, everybody being so young, and many were experienced because they had gone in earlier in their life too, even though they were young. Let's say they went in at age 20, and they put in their 3 years, and then they're called back and activated. And so for many of them, that was the case. But they just had so much more knowledge and understanding of military training, and I just felt like I was somebody struggling to just get some idea of what this military culture was like. But
Right.
it turned out to be a wonderful experience, even though I thought I was dying. They thought I was dying, carted me off to the emergency room twice from the desert.
Oh.
But that kind of esprit de corps that comes from that experience is just, it's undeniable. It's something that civilian life never has a parallel. Never.
Mm-hmm. That's so true. I want to ask you, did you face any sort of ageism from the other soldiers?
Well, I think it was subtle. It was subtle. I don't think my battle buddy was that happy to be by default paired with me, but we made it work. We realized that we needed each other. We're going to get through this. I mean, there were really good things that happened. The awareness that regardless of age, you may have some advantage to offer.